Hey, it's Abigail. Today I'm going to talk about tethered spinal cords, syringomyelia, and how it all ties in with scoliosis. Just to be clear, all the personal issues I'm about to mention and problems that I've had do not apply to all people with scoliosis. In my case, that was tethered spinal cord syndrome. To be more specific, it's occult tight filum terminal. Latin is a mouthful. Basically what that is when the spinal cord is attached to the backbone or the filum down here, and the surgical procedure that I had done to release it is where they go in and they basically snip the spinal cord apart from the filum so that they're separated and the spinal cord floats freely in the spinal canal like it should. I had that procedure done about 3 weeks ago. It was done by Dr. Moss. What happened was when we went in to see the orthopedic surgeon, Dr. Schindel, the person who's going to be doing my spinal fusion surgery sometime in the near future, he pointed out something that the first orthopedic surgeon we went to see did not mention at all, which showed us that this doctor obviously had more experience, so it's also one of the reasons why we went with him to do the spinal fusion surgery. He pointed out to us that unlike most scoliosis cases, I had an even more rare thing occurring. From top to bottom, my curve went from left to right as opposed to right to left. He said that was extremely rare, and he wanted to order an MRI just to check it out to make sure that when he went in and did spinal fusion that there weren't any outstanding issues such as tumours or something like that. He said it was a really small chance that there would be anything wrong, but we went and got the MRI done, and we went in to see the neurologist who deals with brain and spinal cord. We looked through the MRI together and he pointed out a syrinx. It's basically where there's a pocket or like a cyst or like a cavity in the spinal cord where there's cerebral spinal fluid flowing in where it shouldn't be. He found about 3 pockets of it down my spinal cord. He was wondering what was causing it. Well, he got to the bottom of the MRI right down here at the end of my spinal cord, and where it should have been floating freely, instead it was attached, which is tethered spinal cord syndrome. Basically, the procedure, they just go in, snip the filum, detach it, and it's all fine. It all went fine. The one thing that was really tough for about the first day or 2 were these low pressure spinal headaches that I had, and it felt like there was nothing cushioning my brain, and every time I turned over the pressure was so bad in my head that it gave me the most horrible headaches. That's just a little bit on tethered spinal cords. It can cause scoliosis, and my doctor, Dr. Moss, he told us that sometimes with other patients, their scoliosis would be fixed and their spine would straighten out after having the detethering of the spinal cord. Unfortunately, we talked to Dr. Schindel, and he told us that it was too far progressed and mostly idiopathic, which means I was born with it, and there was really no cause. I was going to have both surgeries. As you can see, 3 weeks later, I'm fine. I was actually up and walking only a few days later. A week later, I was pretty much fine. I just got tired a lot, but now I'm really just back to normal. All I have is about a 2-3 inch scar on my lower back. I'm not saying that everyone has these problems that has scoliosis. This was my personal issues that I had. Thanks for watching. Comment, ask questions. Bye. Shine like a star. It's unforgettable now that we